Hey guys, this is Roman again. Now this is part two after my ablation surgery on my brain and my right temporal lobe. Decided to put on the same shirt so you can tell it's me. Okay, so it's been 6 months. I'm getting to the serious point. The surgery did help out with the seizures. It did. However, since I have had about five, difference is that they're about 15 seconds, and I get them about, let's see, once a month. Once I had two in one day. They were about 15 seconds once again. The difference is that I was actually aware of what was going on. Before I would zone out anywhere from a minute and a half to 3 minutes and just not be aware of what's going on, and then I would have that really heavy feeling. Everybody's different, but my heavy feeling was like paranoia, almost death feeling. I mean, something really scary, something I can't explain. Some of you might have the same thing, some of you are gonna feel different. I don't know, this is just my type of epilepsy that I got it down to with medication. Now, the reason I did the surgery, one of the reasons is because it was untreatable with the medication. I was part of that 30%. I know 70% is under control with medication, and the other 30 that are about as lucky as me, they're uncontrollable. So sometimes the surgery helps out for a patient to get treatment to actually be controlled on their medication, and hopefully there's still a while, and I'll be able to get treated on their medications, which is fine with me, at least for now. Uh, but the surgery still did help me out. Right now, actually, I did just get married, and it seemed like I haven't had a problem, at least around my wife. I haven't had a seizure, thank God. But just in case, and I'm pretty sure all of you already did this, tell all your best friends, tell, of course, your wife, your family, especially if you developed it later in life like me. Tell them what to do just in case you have a seizure. Some people get dog tags with their name, address, phone number, even parents' names for everybody that's under 18. And people, you know, with wives' names or brothers' name on it and stuff like that. Uncles, aunts, even. I've seen that before. And so get some dog tags if that's something that will help you. That sometimes you might be able to have a uncontrollable seizure, and then just so it'll be easier for you. It'll be easier for people that could find you on the ground shaking. Um, Now, basically, I told my wife, I told my best friends, if you see me shaking, going to seizure, if I'm just zoning out, put me down on the grass if we're outside or somewhere soft. If I am shaking, make sure you find, once again, either grass or take off your shirt, my shirt, whatever, put it under my head, put me to the side. Now, me personally, I never foamed in the mouth, I never throw up. Uh, People talk about swallowing your tongue. That's bullshit. That's not gonna happen. That's impossible. I mean, try doing it just for fun. Sit at home right now, at this moment, try to swallow your tongue. No, that's not gonna happen. Any neurologist is gonna tell you that's bullshit. Anyways, but the surgery, in my opinion, in some ways was success. Some ways it wasn't. I wish I would have no seizures, and it was a 60-70% chance I would be completely cured of any type of seizures. Unfortunately, it did not happen, but it did help out a lot. I mean, going from zoning out for a minute and a half to 3 minutes to just having a seizure for 15 seconds. After effects are still pretty rough. I think it's not the seizure that scares me the most. It's mainly the after effects, the paranoia feeling, all of that. But it's it helped out a bit. It did. I feel like maybe now we can find and write those on medication. My doctor is amazing. He emails me. I mean, basically gives me free appointments over email. Sometimes he'll call me even at 1 a.m. Okay, now this doctor is great. Andres Miguel Canner, University of Miami, as I mentioned before. If you live somewhere near Miami, definitely give him a call. You can look him up. There's not a single bad review about him. Great guy. I think the best way to end this conversation right here, at least video number 2, is basically to let you guys stay in contact with me. And I don't care, if you have to pass out my email, and this is my main email. People with the same condition as me, there's people with a lot worse of a condition than me that are going for any type of brain surgery, mainly ablation, laser surgery for their brain, for epilepsy, temporal lobes, and anything else. In my case, right temporal lobe, as I mentioned in the first video. So go ahead, write down my email. It's just like my first name, so I'm just gonna spell it out for you. It's ROMAN, N as in Nicholas, dot Sorokin, SOROKIN, N as in Nicholas, one more time. Number 21, once again 21, at gmail.com. So roman.sorokin@gmail.com. Email me at any time, ask me any question you want. I'll get back to you as soon as I can. I'm mainly at work right now, and yes, even with minor seizures like this, I'm able to work. I'm gonna go back to the gym because I lost a lot of weight. I'm very picky about food. That happens sometimes. And send me an email. Let me know exactly how you feel. If you have any questions, go ahead. Ask me private questions. I do have a video of me in the hospital having my first seizure, just like I mentioned once again in the first video. If you would like to see some of that video just to see exactly what I had to go through, I will go ahead and send you that video. I'm going to trim it up a little bit because there's some stuff over there, nurse is changing me and stuff afterwards. I don't think anybody wants to see that. So go ahead and email me. Maybe I'll even give you my phone number, but that's only in the email. That's really if you need it really bad. So please email me, get in contact with me, leave me a comment. I repeat all these things because I really do want you to feel better, to be better. And a lot of people get scared about going through surgeries in general. So I'd like to hear from you. Leave me a comment, email, anything you need, and I will get back to you as soon as I can. Hopefully, maybe even the same day. Okay? So thank you for watching video number 2, and if you'd like me to make more videos, I'm gonna go ahead and make you some more. Thank you.